My topic is Fern-like pattern on ultra-wide field fluorescent angiography across various UAT conditions. To start with, the Fern-like pattern on fluorescent angiography represents diffuse capillary leakage, and the finding is considered typical of Behçet's disease. So it represents inadequate therapeutic response during clinically quiescent periods. The gold standard to detect and monitor both the leaky and the occlusive nature of the retinal vasculitis in Behçet's disease. However, there are a few other non-Behçet's entities where Fern-like pattern can also be present on fluorescent angiography. However, there is sparse literature about those. So, to fill this gap, this study was undertaken. So the study primary objective was to study systemically describe the clinical and imaging characteristics of Fern-like pattern on ultra-wide field fluorescent angiography across various UAT conditions. It was a retrospective review of the clinical records of the eyes presenting with Fern-like leakage on ultra-wide field fluorescent angiography, and the clinical and imaging characteristics were compared between eyes with Behçet's and the non-Behçet's etiology. So the detailed clinical history, which included the presence of oral ulcer, general ulcers, skin lesions, history of TB, etc., was taken, and the complete ophthalmological evaluation was done, and the anterior segment findings and the posterior segment findings, as seen in the uveitis, were noted. And these were the findings which were noted on the ultra-wide field fluorescent angiography. The diagnosis of Behçet's was made on the currently used classification, that is the presence of recurrent oral ulcers plus any two of the following, that is skin lesions, recurrent genital ulcers, ocular manifestations of the positive pathologitis, and the diagnosis of TB uveitis was made according to the CORD study. So the total were 23 eyes, and the mean age was 29.58 years, and the distribution was 3 patients of Behçet's disease, 4 patients of tubercular vasculitis, 2 patients with intermediate uveitis, 1 patient with pan-uveitis. He was a 15-year-old child who was actually turned out to be PIK3CD mutation, which I presented in one of the posters, and the 1 recurrent BKH patient, and the exudative retinal detachment, where we could not find out any cause of the exudative detachment. So the bilateral involvement was in 91.67% of the cases. And this is a patient of the tubercular vasculitis, where we can see the perivascular quadratic patches with a Fern-like leak, and 1 more patient of TB vasculitis with capillary non-profusion areas in the periphery with Fern-like leak and the perivascular quadratic scars. So this was a PIK3CD mutation, a child of pan-uveitis, and this was the exudative detachment. So we can see the Fern-like leak only in the area of the exudative detachment, that is inferiorly. And this is a patient of Behçet's uveitis with history of features of this retinitis and Fern-like leak again. This was a patient of VKH who had initially presented with the typical symptoms of VKH, that the multiple exudative detachments and the pinpoint leak on FP48. And this is a recurrent, recurrence of the VKH, where unusually we have seen a Fern-like leak. So the clinical and the systemic findings which were noted in Behçet's oral and genital ulcer was present, tubercular uveitis, history of TB was present, or immunological or the radiological positive tests were positive, and the perivascular quadratic scars were present. In VKH, SNHL and the vitiligo was present, and minimal findings were seen in intermediate uveitis and the exudative retinal detachment. So these were the anterior segment findings which were seen. So the table showing these findings, what we observed is that in the anterior segment findings, the cells and the posterior synechiae were more in cases of the Behçet's eyes, probably because of the more inflammation. And among the posterior segment findings, the quadratis was in the non-Behçet's group, and NVD was significant in the Behçet's group. On the ultra-wide field fluorescent angiography, in Behçet's group, this NVD was significant, and the disc hyperfluorescence was present in cases of the Behçet's disease. So, to the best of our knowledge, this is the first study to investigate the Fern-like leak on ultra-wide field angiography in Behçet's disease versus non-Behçet's etiology, and the hyperfluorescence of the optic disc was a significant findings in the Behçet's disease in our study, which is similar to the Mesquida et al. And Kirovana et al. Studies. And we speculate that the increased incidence of optic disc hyperfluorescence in Behçet's disease is probably due to the increased severity of the disc. And so the clinical implication is it is not exclusive to the Behçet's, occurring in multiple evaluated conditions. Thank you.
So, what was the take-home message? Because in the significant findings also, like hyperfluorescence, so all these are non-specific findings. So where does your paper take us? Like, what do you want to take-home message from your paper?
So what and then interacted with others also, and in fact the literature also. The moment we see a fern-like pattern on this FFA, we start jumping carrying into Behçet's side. So the message is it is not Behçet's. The messages can be seen in the various other entities, and if you see the literature, if you because a lot of the literature research was also done thereafter, so it is very rarely it is given that it is. I mean, we know, but it has not been documented in the literature that it is seen in these conditions also.
Treatment pattern, you changed your anything?
The treatment is treatment remains same. Like when it's a Behçet's, we start the patient on double immunosuppression, or we can start on the biologics directly. However, the misdiagnosis, like some people we have seen this is one pattern. No, then they make up their mind towards the Behçet's disease, and they start taking the history. You have ulcers, and you can make the wrong diagnosis even the patient is behind get over. So the take-home message is that do not come to the conclusion of the patients because of the wrong pattern, and it can be seen in all entities.
So basically, affect your treatment pattern.
It affects the treatment.
Or any outcome difference you noticed during? No. Because non-uveitic cases also sometimes we notice Behçet's pattern. Even if we can remember the CRP also. In late cases, if you notice there is these leakages and also leukemia also sometimes present.
In fact, there is a paper.
So that's all I wanted to know. Is it does it affect your outcome or what you want?